We are hosting a, we're hosting a Westchester food cupboard drive. And basically there's like a whole list of things that you can buy, and then you just drop it off at Dr. Donzi's office, which is Marion 301. And then you just email proof of it to Tiffany, our secretary, and that's your email right there. And you have 3 weeks to do it. So you have plenty of time. You just gotta buy something and turn it in, and you can get your one event point, which is super relevant because in order to get active membership, you can't miss more than 2 meetings, and then you must participate in at least one event. So that could be your opportunity to get your event point.
All right, now we're going to be welcoming our guest speaker for today. His name is Dr. Mario Aycart. He's a pediatric plastic surgeon at Nemours, and he went to Cornell University and did medical school at Tufts University. And I don't want to get into all of his details because he will be sharing his story to medicine with us today. But if everyone could just welcome Dr. Aycart.
Hey guys, thanks for having me. So thanks for to Karen. Can you guys hear me okay?
Yeah.
All right, perfect. Good. Yeah, so Karen reached out and asked if I could join your meeting and then just kind of chat basically about my story. And I kind of wanted to have it kind of an open dialogue, kind of Q&A, just you know, open book, just if you guys have any questions, anything that you guys are interested in, or anything that you want me to clarify, and more than happy to answer now or via email, or it doesn't have to happen today. I'm happy to do it at another point. So yeah, so I guess I think Karen had highlighted some points that she wanted me to kind of talk about. So I just forwarded her the my profile, like from the website, that kind of just has the general kind of biography, and then it kind of goes into some detail into sort of like why I chose medicine, or why I chose plastic surgery, or specifically pediatric plastic surgery. And so those were sort of things that I had always sort of thought about, but to finally put down on kind of pen to paper and really kind of consolidate your why is super important. So, I mean, I think for me, it was actually quite easy to do that. I don't like writing about myself. Aside from, LinkedIn, I don't have social media. One of the few plastic surgeons that I think probably has held out at this point. But I think when it came time to actually writing, why was it, that I went into medicine? What makes me so passionate about the things that I do? It was actually quite easy. So I would probably start by saying, um, your why, right? Your WHY, as to like why you do things every day, why you wake up, why you are deciding to pursue it is that what it is that you're deciding to pursue is super important. It's probably the most important thing, um, because I think um, fads and things, and your maybe your interests can kind of change, can come and go, but you're sort of that root of your foundation as to why you want to do it and why you want to pursue medicine, that has to be rooted in sort of in a solid foundation. So that's what I would start by saying in terms of kind of just right off the bat. So for me, I was born in Ecuador. I was born in South America. I came to the States when I was 6 years old. My mother and father were 27 and 30. I had a younger sister who was 3 at the time. So we settled in South Florida. So I grew up in Miami, Florida. It was very easy at the time to grow up in South Florida in the 90s, really. Um, One, I mean, my parents eventually learned English, but for a while you could kind of get by in Miami in South Florida by just, knowing Spanish, and same thing for me. So I was in ESL, maybe you guys have heard of it, the English as a second language for a few years. So kindergarten, first grade, and second grade. By second grade, I was sort of phased out of ESL, and then went to public school my whole life, elementary school, middle school, and high school. Um, and I grew up playing a bunch of different sports. Currently, I'm sitting watching my 8-year-old in soccer practice now, which is why I'm here in the car. Um, and then had some opportunities to kind of play and kind of do athletics and academics in the collegiate level. So I was very blessed to have those opportunities sort of along the way. And then, after that, undergrad was very, very challenging for sure. It definitely was very different than high school. I felt like that was definitely a big sort of wake up for me, was to be able to move, outside of Florida, outside of Miami, and kind of just completely kind of challenge myself in that way, kind of culturally. To go up to Cornell and Ithaca, I had never seen snow. I had never sort of been really outside of South Florida. So that I thought was a pivotal point, I think, in my upbringing, to really kind of like move outside of your comfort zone early on, right? Um, I think, being, you know, first generation and kind of not knowing the language and all that stuff, I mean, has its own sort of challenges and barriers along the way. But I think I was young enough where it was just sort of like, it's no big deal. It's just kind of the way that it is. And you just kind of, whatever, you learn English, you assimilate to the culture, and you kind of just make do, and it's not a big deal. And there were so many other kids that were in the same situation as me that it was just sort of like, okay, like these guys can do it, like I can do it, and it's no big deal. But I would say definitely for college and definitely med school, kind of pushing that boundary, that personal boundary that you have, and being uncomfortable and being okay being uncomfortable is super important, I thought, because that definitely allowed me to like expand my horizons for sure. And so since you guys are in college, and I guess during my story right now we're in college, I would say one of the really, really important programs, summer medical programs for me, was it's still around because I looked it up, but it was sponsored by the AAMC, and it's called Summer Medical Education Program. And then they changed the name. It was like Summer Medical and Dental Education Program, and so it's undergone some iterations. But I did this program at Duke, which I don't think it's still a site, but I know that the program is still around because I've sort of looked it up. And so it was like the 6 week program after my freshman year, before my sophomore year, that it was like fully paid for. You apply, and whether it's like, I think they call it like health professions summer education program now. Um, but it was really, really important because there again, it's sort of like was an introduction to like organic chemistry, cell biology. So you took some classes and then you shadowed at the hospital. You took some electives as well. You had some like literature in medicine. Um, and it was, mostly minorities in medicine, but it was people from all walks of life. So it was very, very diverse for sure. And I would say that was another sort of point along my academic journey that I would point to in saying like, okay, this was also like really awesome and kind of eye opening and allowed me to kind of like think about things in a different way again. Um, so that I would encourage you guys, if you guys haven't. I think it was 6 to 8 weeks summer. It's completely paid for. You had a stipend, um, and it was a really, really, really awesome opportunity. And I think one of my professors actually wrote one of my letters of recommendation, if I'm not mistaken. But anyways, I thought it was great. It made a lot of really good connections, and it had a really, really good track record of like placing students in dental school, in med school, as like another sort of like extracurricular, worthwhile experience, because it wasn't only classes, but it was also, like I said, you had dedicated time shadowing, you had dedicated time in the hospital, and so it was a really, really good exposure to a bunch of different things. And so it was great. So I did that program between my freshman and sophomore year, and then between my junior and senior year, I did a program in New York City in Cornell, through the Cornell Medical School, which is in New York City, which is also amazing. It was much smaller, and I think it was a little bit longer. And plus, you were in New York City for 8 weeks of the summer, like as a junior in college, which was amazing. And so that one was also pretty similar, where you were like taking classes like biochemistry and things like that. But again, you were like in the hospital, you were shadowing, and then you were paired up to do a research project. For me, it was clinical because my minor was in nutrition. and my major was in bio. And so that was another like really, really cool summer program where you got to do research. You kind of just like went in. Some people went into a lab. For me, it was clinical research. So I kind of just walked into an existing project and was able to get it up and running within a reasonable amount of time. So I think those two summer programs were also really, really key and really important in my application. In addition to like the usual stuff, the GPA, the MCAT, for me, it was also like collegiate athletics. And so just having that kind of well-rounded application and then having those two experiences where you had to apply and interview and like, get into the program was also I thought was super helpful in getting into med school. Um, yeah, so I'll stop there and take any questions before I kind of move on from college to then med school.
What was like the process like for you to applying to medical school?
Yeah, yeah. So basically, at the time when I applied, and I know that it's not the case now, but at the time when I applied, you had the MCAT, paper and pencil, wasn't computerized, and it was only in April or only in August. Like you had two chances, right? And so you had to take it in April of your junior year if you wanted to go, if you wanted to essentially, apply to med school thereafter. And if you basically were like, well, I'm going to take it in the summer, then you either had to take it as a sophomore, or you're basically saying I'm going to take a year off and then do that. I know now that having been through residency and having been through like residency for a while, and I did my residency through Harvard Med School hospital. Um, all those guys, like they were guys and gals, they were taking like a year off to do research, and that's like more and more sort of like a thing now where people are taking extra years off like in undergrad, and then they're taking like extra years off during med school to like do more research and like get into labs and publish and get their names out there, et cetera, et cetera. um, what I would say is just it may be hard, but try to resist the temptation to do that if it's not something that you're like passionate about. If it's something that you're like, yes, like I want to do this because of your why, right? Of whatever you're interested in it, and you see that it excites you and you're able to do it. And sometimes financially is another thing. Sometimes financially people can't do that. It's you're taking another year off. Sometimes your loans start to accrue interest, and so sometimes it's a big financial strain. And so I totally get that. And so if you're going to do it, just make sure that it's for the right reasons, not just because you want another line on your CV. And I know that trust me, I know that there's a huge pressure because I see it. I saw it in Boston and I was there for 10 years and I still see it now. So, but try to resist temptation unless it's something that's definitely, part of what you want. So I took it in April. I applied all through the summer when I was at Cornell in the New York program. I got all my stuff ready. I, chose a school that that I thought I would want to go to. Most of them were sort of on the coast. I had no desire to really go to the West Coast or the Midwest for that matter. And there was the usual like couple of reach, a good sort of middle pack where you think you're competitive and it's also good. And then for me, a lot of it was just sort of location, which is why I ended up I think in Boston. Um, and yeah, I mean I think it was pretty straightforward like it is now. I think, you had your standard application. It's a lot of money for sure, a lot of money, and a lot of travel during your senior year if you're doing it during that time. But I thought the interviews they were thoughtful, they were straightforward, I thought. And I think in med school, and I think at least for residency, when I interviewed applicants for residency applications, they're really trying to once you've got the interview, you're sort of like past that baseline of like GPA, extracurriculars, all those objective measures, and it more so becomes like a fit. And not only like do you fit into this class, do you fit into this med school, um, which is important, but also, how do you fit like personality wise? Like, are you someone that's going to like thrive in medicine? Do you kind of know what you're getting yourself into? What are your aspirations? And they're trying to get at like, what is your why? Like, why is it that, you're doing this? What are the reasons why? What is it that excites you about medicine? I think they're trying to get a sense of that. So for me, having those two opportunities, at Duke and then at Cornell, like kind of showed and saying, hey, look, I did all this extra stuff. I spent some time in the hospital, I have these letters of recommendation. So, I mean, I was able to kind of show that within my academics and athletics, I had sort of sought out these other opportunities that were like clinical, that had that exposure to say, like, hey, yes, by the way, I do know a little bit about kind of what medicine is about. This is what excites me. This is what I look forward to. And so I was able to sort of tie those opportunities in to like my application. So that's why I thought those two summer programs were super helpful in the application process.
Would you say that like practicing your interview with like friends or mentors like helped you when you were applying? Like once you got past the
So disconnected there. Interviews, it does. I think it does. I think it does help. Um, it helps it sort of flow, right? And to be honest with you, like it kind of depends on your application, your interviewee as well. Like I had several interviewers who basically were putting, and again, I did this in residency as well for medical students applying into residency. Like they'll give you situational questions. Like they really try to get at like who is this person? Like how is this person going to react at 3 in the morning when they're getting called by the nurse? So they'll give you situational questions to say like, okay, so you are, and kind of like ethical questions as well. So you can't really prepare for that. Like you can have your elevator pitch, right? You can say like, oh, my name is so and so, I enjoy XYZ or, what have you. You can have your 10, 15-second elevator pitch, but interviewers now, they kind of want to delve a little deeper, at least as for what I've seen for residency interviews. And I think it may change also for medical school as well. They're trying to get the sense of like, who is this person? Right? Because they know the 4.0, the 40 GP, the 40 MCAT, like all that stuff. Like they know all that stuff, right? It's all the same, right? At the end of the day, it's sort of like, okay, what is this person going to be like as a medical student? Is this person going to finish, right? Because there's attrition in medical school, just like there's attrition in residency. It's probably not as high as it is in surgical residencies, um, but there's certainly attrition, and yeah, that's okay. Stuff happens. But I think, the interview process is becoming more and more sort of situational. Like, they'll give you situations like, and they'll have you choose like, okay, what is this person going to do now? Is they going to do this or are they going to do that? And they try to sort of kind of get a sense of, who you are as a person.
I had a question. What
okay.
classes as an undergrad did you take that you found beneficial while you were in medical school?
It's a good question. So I wouldn't necessarily say there was any one, probably biochemistry, maybe, but biochemistry, you just take your first year of med school and then you're done. There's some people in at Cornell that they had a whole anatomy and physiology course, and that obviously I think was very, very popular at Cornell for obvious reasons because physiology and anatomy are heavily taught in med school. Um, but what I would say is, so I would say those two classes would be one. I would take a step back and I would say that it's the overall course load, right? And the ability to kind of have like a heavy plate and prioritize your time and know what's important, know what isn't, and kind of like have those skills really, really etched out before you start med school is sort of the more important point, if that makes sense, right? Um, so I think at Cornell it was really, really, really challenging. Like it was really hard compared to high school. High school was a joke. I didn't do anything in high school and like, and it was fine. Once I got to Cornell, like it was a big like slap in the face. And then what was interesting is that those same study habits and those same kind of prioritization and that same rigor that I had that I established there translated to med school. And I was like, oh, I got to med school and I was like, oh, okay, well, I've been doing this already. Like I know what I'm supposed to do. I know how hard I'm supposed to study and I know the level that it's sort of expected of me. And so when I got to med school, it was like, okay, I've been doing this already for whatever 3 years. It's okay. And I just sort of kind of continued on that. So I would say it's less about the specific course, although I think biochemistry and anatomy and physiology, just as a disclaimer, would be like the important ones. And it's more so like, how do you prepare yourself, right? Like your study habits, your priorities, to do well. And then in med school, really, like I think most medical schools are fairly similar. I mean, I think Duke stood out to me in that they sort of had like extra programs that were sort of built into the curriculum. And then they would pile the first 2 years of like preclinical into 1 year. Then that left you with like your second year to do an MPH, an MBA, clinical research. And so Duke was kind of special in doing that. But most med schools are like your first 2 years are preclinical, your third and fourth year are rotations. And it's sort of like pretty fairly similar. And so there are certain med schools out there that are like a little bit smaller, like Mayo Clinic is like a little bit smaller. They have really, really good scholarships. You are in Rochester, Minnesota, which, could be plus or minus to some. So it kind of depends on, in terms of like med school specifics. There are some, you know, nuances of the curriculum, but like by and large, they're all fairly similar, right? They're all going through the same process, and now there's more of an emphasis on problem-based learning and PBL. And so at Tufts, it was a big emphasis. At Harvard, it was a huge emphasis, but they still all had like, lectures, et cetera. And so didactics, right? But some schools just really hone in more on like the small group problem-based learning, which for some people it's cool. And for some people it's like, yeah, it's not they prefer not to, right? And so you kind of have to know yourself and then just do that research beforehand, to kind of see what the curriculum is like and what you're drawn to and what potentially, your strengths are. Are you guys all pre-med? Pretty much, maybe
Yeah, we have
so.
mostly pre-med. There's some pre-PA, pre-dental, pre-optometry.
That's great. So that's also really good. Um, I yeah, I don't think I ever had like exposure to, PA wasn't really like a thing when I was kind of going through the process, but now it's definitely become a thing. Um, nurse practitioners obviously, playing a huge role in primary care in general, and PAs as well. So PAs, like we have two PAs within plastic surgery. There's a ton in our hospital, and there's even more. So in Boston, where I trained, the PAs had a huge role. They were in the OR, they were in the clinics, and they were on the inpatient floors as well. So they played a huge role. And sometimes I'm surprised that it's only 2 years because it can be pretty heavy in terms of kind of what you're expected to do. But I think that may be dependent on like your exposures. Um, but I think one of our PAs, if I'm not mistaken, she does Westchester have a PA program? It does, right? Yeah. So yeah, I mean, I think that's awesome if people are exploring that as well. Like, I think it's a great field, and I think there's more and more people that are being drawn to it. For like, you're in medicine, you're like semi-independent depending on what you're doing, but at the same time, you're sort of like you have a little bit more balance and a little bit more control. And people like that. And so I say, kudos to you. If you feel like that's something that you want to do, then awesome to explore it. And I had some friends as well from high school choose to go to optometry. They stayed down in South Florida, and they're also very, very happy choosing that. Again, it's sort of like science and like, serving and like seeing patients and like, helping them. But also like it's strictly like outpatient and the clinic base. And so if that's something that you like and that's something that sort of speaks to you, then great. Then that's awesome. Um, I'm very much like we're all we're all interested in like science and in medicine, but there's so many different paths to get to where you want to get to, and everyone I think is um, different in a good way. That whatever it is that sort of speaks to you, then certainly pursue that.
What made you choose pediatric plastic surgery as your specialty?
Hmm. Yeah, that was definitely when I was within plastic surgery. I rotated through Boston Children's Hospital, and then we got to do a lot of like really awesome surgeries, and specifically, cleft lip and palate really stood out as like this sort of like just life changing, surgery and opportunity. And what initially sort of held me back was the fellowships to get into a pediatric craniofacial fellowship, and the jobs are very, very scarce. So what ends up happening is that these guys and gals who go into the field, they just stay working until they're 80, 75, 80. And so basically there's not as many jobs in general. And so that was my big sort of detractor. But again, I still just felt that I fell in love with it. And so that didn't sort of hold me back. And again, things work out. And so I was able to get a pediatric, craniofacial job, here in Delaware, and it's been great. And it's been great being able to serve, to being able to help patients and families in such an impactful way. So it was really the that rotation, and what I saw was like a lifelong impact, that you're meeting patients and families prenatally. So you have the ultrasound of the baby, and you're meeting the mom and typically the dad and extended families who are very, very anxious at getting this diagnosis. And then you're able to sort of help them and guide them and meet them at a very, very difficult place in their lives. So it's really, really awesome. And it's like a huge privilege. Like, I just think it's like such a huge privilege that I've been like blessed with the opportunities to like take advantage of just science and medicine and life, and be able to like serve and give back. I think is pretty awesome. So yeah, I think as I was going through training, I kind of thought of that, and I was like, well, there are plenty of aspects of plastic surgery that are really awesome too, but this one again just spoke to me in particular, and that's one of the reasons why I chose it.
My brother actually got like a cleft lip palate surgery when he was younger, and he's 12 now, so he's like gone through multiple plastic surgeries. But yeah, like that specialty is definitely very life-changing, and like you get to follow your patient like throughout their life pretty much. So yeah, very
Yeah, for sure it is. Yeah, 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 absolutely. So um yeah, it's lifelong, so it's pretty awesome that you're able to meet them prenatally, or and then when they're born. Like, for example, today I met a little 1 day old who was born with a cleft lip and palate. I had met mom again prenatally, and so now she delivered, and was able to meet with them and stuff and kind of guide them along the way. It's really really special. I felt like even within plastic surgery, you're able to you meet patients through all walks of life, and I kind of appreciated that. And within plastic surgery in general, you are sort of like a doctor's doctor. You're helping out a lot of different specialties. you're helping out orthopedic surgeons for trauma or for things that need closure. You're obviously helping out, neurosurgeons for craniofacial things. You're helping, these little kids out with cleft lip and palate. You're helping out oncologists for like breast reconstruction. That's all, plastic surgery as well. So you're helping out a lot of different services and a lot of different patients through like, different walks of life. So I found that to be like super awesome and really rewarding. It's tough and it's challenging, but it's also very rewarding. So for me, it was just something that spoke to me. And it was easy to choose at that time.
Could you walk us through like a typical day in the life of you, like day in the life as a surgeon, and kind of like how you balance your work life and your personal life?
Yeah, for sure. It's really hard. I have an awesome wife. I have two kids. We had them during residency, which was really hard because we were away from family. Like I said, my family is down in Miami. I did all my training. I did my med school and all my training in Boston. Um, and the training in residency is like it's pretty rigorous, and it doesn't matter whether you're doing dermatology or whether you're doing internal medicine, psychiatry, OBGYN, surgery. Like for me, surgical residencies were very challenging, but I think they need to be because you're cutting into another human being, and so you need to be ready to like know what that means, know what you're doing, and you just have to be able to kind of handle the stress that comes with that and the sleep deprivation as well. So it was very hard. There's definitely some compromises that I had to make early on, and we just decided to have my wife stay home. I also was blessed and to work with a lot of female surgical residents as well that delivered during residency, which was, it just I can't even begin to imagine. But so I was able to work with several female residents who yeah, who gave birth during residency and had 6 to 8 weeks out, and they were like back at work. Some of those policies are changing, I think, but it's very, very hard. It's doable, but it's hard. And so most people wait until they're done with residency to have, to start a family. I think it's connected. I feel like that's okay, and that's a personal decision. And everyone's going to be a little bit different, and that's okay. So for me, it was super helpful to have a supportive significant other. And yeah, we had them early on during residency, and it was tough. But definitely there was like some times where you're making compromises and you have to go to work. You have very little. At least in residency, you have very little control over your time and your schedule. You're kind of just at the whim of what is needed of you. Um, and now it's a little bit different. So I would say that's kind of the light at the end of the tunnel is like, after residency and after fellowship, you do have a little bit more control of your time. You are able to like now, for example, like, I went to work today, I had a clinic in the morning. Um, I am on call, but so far so good. And I'm able to drop, my child off at soccer and like stick around and then go home, help them with homework and stuff like that. And so it's a little bit more predictable now after residency, but I would say in medical school and residency, that's all, it's pretty standard and pretty rigorous. But afterwards, as an attending, as a staff, you do have a little bit more control of your time. And every day is going to be a little bit different. Like tomorrow, for example, I'm doing a cleft lip in the OR in the morning. And then, every day is a little bit different with regards to like operating room or clinic or sort of other administrative duties. But, that's just my schedule in particular. There are, again, if you were, a neurologist, for example, you're pretty much going to be doing, clinic all day, seeing patients in the hospital, outpatient, et cetera. And so, the day in the life is sort of dependent on your specialty, and that's going to vary a little bit. But for me, it's some combination of like clinic um, and an operating room.
I just wanted to ask, what are like the biggest factors that go into choosing a specialty, and what do you wish you knew before specializing?
That's a good question. So I think early on, you can sort of say, okay, procedural versus not procedural, right? It's like you can kind of group these things into kind of broader or bigger topics, right? So it's like, do you see yourself being in a surgical subspecialty or a non-surgical subspecialty, right? Because then that narrows things down quite a bit. So, so for me, I was always sort of leaning more towards procedural and surgeries, and I think that probably started early on in med school with like anatomy. And so at Tufts, it was awesome because the cadavers weren't prosected. They were basically, you had to dissect them yourselves and make them look like the anatomy book. There are some med schools that just have the things kind of ready for you, but it wasn't the case for me. So I thought that was one of the big things I think early on that I was like, okay, this is pretty awesome. Um, but I think if you're looking at a specialty, it's sort of like, I think that's probably the one big question to start would be, okay, procedure, yes, no, and then kind of make your way down through that. Because there's so many different like branches, so many specialties and subspecialties and like radiology and pathology and dermatology and radiation oncology. Like there's so many that it's a little daunting to think about one in particular, but that's probably the one way I would start is kind of if you're thinking about it, it's like sort of, do I see myself performing procedures, yes or no, and then kind of walk down that path.
Do you want to share like your email or just like on contact information so that like if anyone has questions after, they can
Yeah,
just drop to you?
yeah, for sure. Karen, Karen has my email, so she's more than welcome to share it with you guys. That's my personal email. Happy to answer any questions or anything that comes up, at all, that you guys want answered. Do you guys have a? I'm sure you guys have to have it, but who is your supervisor? I guess you guys have like one mentor or supervisor at Westchester.
It's Dr. Donzi. She's actually also the advisor of the pre-med program, and she's also the advisor of our club.
Got it. So what does she do? Is she PhD or she MD?
She's a PhD.
Oh, I see. Okay. All right, cool. And do you guys feel maybe supported is not maybe a great word, but yeah, like supported and understood of kind of like what the next steps are and like what the pathway is in terms of applying and things like that. You guys are pretty well set.
Yeah, she does like a good job of having like one-on-one meetings with us and then just like addressing any questions we have for a lot of not just pre-med, but like a lot of other like medical tracks as well. So yeah, she does a
Yeah,
good job of making sure we're prepared and like we know what's coming.
good, good. Yeah. Yeah, no, I'm happy to answer any questions, anything that comes up at all that you guys have questions about. Yeah, I'm happy to email. Yeah, not a problem at all. And I think Karen should. Yeah, we've been connecting with via email.
Sounds good. If anyone doesn't have any other questions, I put the attendance QR code back up. So if everyone could just scan that if they haven't already and just register. And then before we end, I also just want to take a quick picture. I know it's over Zoom, but just for our socials. Um, so I will be taking this screen down in like 10 seconds. So if you haven't scanned it, do it now.
That's cool that you guys track attendance, huh? And you have to have certain points in order to stay in the club.
Yeah, so we have something called active membership. So in order to be like an active member, you can't
Yeah,
miss.
you actually have to do stuff then. Yeah.
Yeah. Yeah, you can't miss more than 3 meetings, and then you just have to have like 2 events. We had like a blood drive in February with the American Red Cross, which a lot of our members donated blood in. So that was like one way that a lot of our members got an event point. But
That's
yeah.
good. Did anyone pass out or everyone was good?
No, they check your vitals and all before, so I think everyone was fine.
Good.
Thankfully. Okay, I'm gonna stop sharing this now. Okay, whoever wants to turn on their cameras for the picture, you guys should. And then I feel like we're like in COVID again, taking pictures on Zoom, but okay. I'm gonna take it. So everyone smile. Okay, perfect. I just want to thank you so much, Dr. Aycart. This was super helpful, just for a lot of different stances. And then we have your email, so we'll share that in our just check for Tiffany's email. We'll have that in there. And we'll also have like the link to this recording since we were recording this Zoom. But yeah, thank you so much. And I'm
Yeah,
sure
of course,
our
my
members
pleasure.
will be reaching out.
Yeah, sounds great. Good luck, guys.
Thank you.
Thank you.
Bye.
Bye.